Let's start. Hello, everyone. Very good evening to all of you. I hope all of you are doing great. See, exam is over, 18th June over. I hope all of you have done great. The people who have completed their exam, I wish you all the luck. So for you people, I would suggest you please rest for a few days, and after that you take some decision. Okay, and after that you do something else, study or whatever you want to do. I wish you all the luck. But for the people who are going to write exam in December 2021, yes, I have some suggestions and how to prepare for the exam, what to do, okay, how to take care of all the 19 subjects. I will be discussing with you. Okay, all right. See, although there is no any blueprint of the FMGE exam that what kind of questions will come, okay, out of 19 subjects, okay, number of questions will be up to 300. See, as per the recent analysis of last few exams, we can say that, okay, number of questions, okay, clinical questions. First of all, when I talk about the clinical questions are 150. And after that, okay, fact-based questions. I can say one-liner questions, fact-based questions are 100. And then image-based questions are 50. Okay, so this is the normal pattern out of which examiners are framing questions. See, if I ask you one question that, what are the expectations from FMGs? First of all, when you come back to India after graduating from WHO recognized universities, okay, like this is the first expectation that I just want to tell you the expectations. How much you know about the medicine? How efficient are you in taking care of patients? And after that, how much you are exposed to the modern medicine and the technologies? And assessment of these is done by this exam only. Okay, so they are going to ask a number of question will be up to 300, and with the help of these questions, examiners want to know your level. Fine. So I think, like the kind of questions what they are framing, the kind of question what they are making, this is really very important to understand. Okay, so I have a plan for you people. I will be coming live on YouTube for next 5 days, and after that, I will be discussing the integrated pattern of anatomy, physiology, biochemistry, and pathology, microbiology, pharmacology. How they are framing questions from anatomy. See, earlier most of the questions used to be one-liner. Okay, they used to ask what is the reason for wrist drop, or which nerve injury is seen in wrist drop. Okay, so radial nerve, I can understand that. Okay, yeah, but now how they are framing this kind of question? As we all know that radial nerve, okay, from the spiral groove of humerus, okay, radial nerve is passing. Okay, so now how they are framing this question? One orthopedic surgeon is operating. One orthopedic surgeon was operating near a spiral groove of humerus. After that, after a few days, patient is presenting like this. Okay, this can be your image-based question also. So basically, this is wrist drop. After that, they are asking this kind of question that which nerve injury might have injured during that orthopedic surgery. So now in this way, they are framing questions and they are asking the questions. Okay, so like day one, I'm going to start with the correlation of subjects with clinical management. Okay, so first of all, please understand that, okay, what kind of question they are asking from the clinical management. See, the basic things as an intern, how much you can help in hospital. Okay, this much, okay, only this much expectation is there from you. Okay, no? So the basic clinical skills which you should be knowing after completion of your MBBS. Okay, no? So these basic clinical practice are being asked in a clinically integrated manner questions here. Okay, so first question for you people here. An intern has to take blood sample for ABG. ABG means arterial blood gas analysis. He is not able to take the sample from radial side, radial artery. Senior resident suggested him to take femoral sample. Which area he should palpate to withdraw the blood sample? Answer me, please. Answer me, please. Okay, fine. Chalo, I have seen your answer here. See, in this question, this is actually a very easy question. Okay, see what they are asking in this question. See, examiner, how he has framed this question. Actually, he is asking the basic anatomy of femoral artery, location of femoral artery. Location of femoral artery, that's it. Okay, landmark of femoral artery, that's it. Where exactly, at which point you are going to check the femoral artery. At which point you will be able to, okay, you will be able to palpate the femoral artery. Okay, no, so this is actually basic anatomy question, but this question is being asked in an clinically integrated manner. Okay, so that you should be able to understand, so that you can understand that when you are going to take the sample, okay, from which part, okay, from which area you can palpate, at which part you are going to palpate the femoral artery. Okay, fine. So I can see your answer and most of you are wrong. You are marking D. I hope all of you know that femoral artery is located in between anterior superior iliac spine and pubic symphysis. When I draw a diagram like this, and this is ASIS, and this is umbilicus. So you know what? Pubic symphysis. Fine. I hope all of you know this point, that whenever you are supposed to palpate the femoral artery, you are going to palpate in the inguinal region. But which region you are going to? Okay, which region you are going to palpate? Please understand that femoral artery is actually in between ASIS and the pubic symphysis, here at this place only. Easy to understand. So your answer is B. If you see this question, you can understand that examiner wanted to ask you just the basic anatomy question, but he has framed this question in a clinically integrated manner. Actually, when I joined as a resident doctor in burns and plastic surgery department, on my first day in burns ward, okay, burns, my senior asked me, do you know how to take femoral sample? Do you know how to do sampling? I said, of course, this is like an intern work. I can do, of course I can do. Okay, so he asked me, okay, fine, go and do. After that, when I went to see the patient, okay, patient was 85% burn. 85% burn. Okay, 85% burn. And when I reached there, I saw that, okay, patient was wrapped almost 100% into the dressing. Okay, full dressing across the body. Entire body was, okay, like entire body was having the dressing. I asked my senior, sir, how to take sample? Actually full of dressing. Okay, I cannot see any open space there. He asked me, okay, just now you told me, no, you can do sampling like a pro. Okay, fine, go and do. I said, yes, sir, I can do, but I cannot see a place from where I can take the sample. After that, he wore surgical gloves. He removed a small part in the inguinal region. After that, he asked me, now you see, After that, I saw there was 1 centimeter thick there. Okay, that was full of mayonnaise. Actually, pus collection. I said, sir, how can I see blood vessel there? After that, he touched that mayonnaise. After that, he asked me, okay, fine. Are you able to feel any palpation here in the pus? Okay, no, fine. I said, yes, sir, I can feel pulsation here. He asked me, okay, pulsation is there. This is artery or vein? I said, okay, of course, this is artery. Yeah, this is your femoral artery. Okay, just next to femoral artery, there is vein. You can take the venous sample there. As all of us know that, okay, medial to lateral, okay, medial to lateral, VAN. Okay, no, so vein, artery, and nerve, okay, they run together, medial to lateral, right? No, fine. So he asked me, I hope you remember the basic anatomy of first year. Okay, so just after femoral artery, there is femoral vein. Okay, take a blind shot, and after that, you take the sample. Okay, finish your job. Okay, fine, go. So this is what actually, this is the application of subjects which exactly you have learned. Okay, now, so this question was very, very easy. Simple question, location of femoral artery. Okay, where it is? Okay, this is in between anterior, superior, iliac spine and pubic symphysis. Answer is B here. I hope this clinical question is very easy for you now. Next question. See, a clinician is trying to auscultate which valve? Actually, this is also very, very easy question. Actually, this is 100% clinical practice. Okay, when you will be doing your internship, at that time you have to do all these examinations. This is basic examination. Auscultation is being performed here. So please answer me. Clinician is trying to auscultate which valve here? A, B, C, D. Okay, chalo, fine. See, I hope all of you know the basic anatomy of heart valves. Heart valves. Okay? Samajhte isko. See, I ask all of you to touch your clavicle. I ask all of you to touch your clavicle. Okay? Clavicle part. Yes, clavicle bone. See, just behind the clavicle bone, you have first rib. Okay, so just behind the clavicle bone, you have first rib, and below that there is a space that is first intercostal space. After that, second rib. After that, second intercostal space. Okay, now see, in between there is a sternum. See, in between there is a sternum, and second intercostal space, and third, and this will be fourth intercostal space. Okay, fine. I think this should be somewhat lower. See what is happening here. I hope all of you know the basic anatomy of aortic valve and the pulmonary valve and tricuspid valve, mitral valve. How to understand? Very easy to understand. Just now I have taught you that. See, in between there is a sternum. See, right intercostal space, second right intercostal space. This one, second right intercostal space, just at the border of a sternum. There is aortic valve, and you come to left side, left second intercostal space. Along the border of a sternum, there is pulmonary valve. And you go below in the same direction, in fourth intercostal space, okay, just at the left side of the sternum, there is a tricuspid valve. Easy to understand? Fine here. See, this is right side, and this is left side. Okay, so second intercostal space, there is aortic valve. Second intercostal space, right, there is aortic valve. Left intercostal space, there is pulmonary valve. Fourth intercostal space, just at the left border of a sternum here. Fine. So there will be, okay, there will be the tricuspid valve, and the fifth intercostal space. Okay, just go in the mid-clavicular line. Ideally it is like, okay, so just above the nipple, fifth intercostal space in the mid-clavicular line, there is mitral valve. Easy to understand. So when I ask you that, see, this is a sternum. Now you are going to answer me. Okay, now you are going to answer me. See, this is the right side and this is left side. when I keep a stethoscope here, okay, when I keep a stethoscope here, this is, okay, this is second intercostal space, okay, right? Okay, so this will be aortic valve or pulmonary valve. So of course this will be aortic. Okay, so when I keep my stent, okay, when I keep my stent, like stent diaphragm over the left second intercostal space. Now you tell me which valve is this? Which valve is this? Okay, see, this is the pulmonary valve. Okay, this is pulmonary valve. And fourth intercostal space here, right? A fourth intercostal space here, right? Fourth intercostal space just at the left of the sternum. This is actually the tricuspid valve. And a fifth intercostal space just above the nipple in the mid-clavicular line, there will be mitral valve. In this way, we do auscultation of heart. Here, answer is what? D. I hope this is clear to all of you. So this was actually a clinical question related to your basic anatomy of first year. But this kind of questions are frequently asked in MCI. Okay, so next question now. How to measure the length of shown tube before fixing it in a patient? So first of all, see, this is a picture-based question. And this is very, very basic clinical practice, very, very basic. I would say this is actually ABCD of your internship, okay? Whenever you are going to join your internship, okay, this thing will be piece of cake for you. Every day, at least for 1 or 2 patients, you will have to, okay, you will have to insert it. You will have to fix it. So this is what, so if I ask you, when you see in the picture, what is the name of this tube? Okay, this is called as a Ryle's tube, right? And this is called as the Ryle's tube, which is your nasogastric tube. So now if I ask you, what is the function of Ryle's tube? Ryle's tube is having very, very important function. Whenever there will be upper GI bleed, at that time when you have to assess the upper GI bleed, okay, upper GI bleed, when you have to evaluate it, right? At that time also for the aspiration, you have to insert it. In a case of poisoning, whenever you have to, okay, whenever you have to aspirate the gastric content, at that time also you have to insert it. Fine. So this is basically what? This is a nasogastric tube. Okay, this is a nasogastric tube. Okay, from the nasal tract, you are going into the stomach. Fine, you are going to insert this tube into the stomach. So related to this photo, related to this tube, repeatedly asked questions are there. So many questions can be framed. Okay, no, I have framed up to 2 questions. And you know one thing, same question was also asked in AIMS. Okay, no, same question was also asked in AIMS. So basically, see, even for the PG exam, okay, they want to assess, okay, they want to assess the basic clinical skills. Do you have, okay, do you have basic information about clinical practice or not? So even you are a junior doctor, but you are going to support your seniors or not. So basic clinical practice you should know. And these questions, okay, these clinical practice, okay, these questions are being framed in your exam. Fine. So first question is that, suppose when you are going to insert, whenever you are going to fix this tube, how you are going to insert and how you are going to measure the length, because you know, okay, see, how much length you are going to put inside that you should also know, right? No? So how you are going to measure the length of the tube? Okay, this is actually, see, this is like in this fashion. So you have to open it. When you are going to open it, this will become long, right? So how to measure the length? Up to how much centimeter you are going to insert so that the tip will be in stomach only, right? Okay, no? Fine. So see, if I ask you one question, that from upper incisor to the distal part of esophagus, how much is the length of alimentary tube? How much is the length? I'm not asking you the length of esophagus. I'm asking you the length of alimentary canal from upper incisor to the lowest part of esophagus. Fine. Some of you might be thinking 25 centimeter. Some of you might be thinking up to 25 centimeter. Okay. Some of you might be thinking 40 centimeter. What is the answer here? Tell me, what is the answer? Answer is 40 centimeter only. Okay, some of you might be thinking, Acha, 25 centimeter esophagus, but esophagus will start from here, okay, from here only, right now. So, okay, so I'm asking you the question, okay, the length from upper incisor to the lower part of the esophagus, okay, lowest part, that is 40 centimeter. Okay, no? So now I have one information that, okay, like this length is approximately 40 centimeter. But when I have to insert a Ryle's tube, how I'm going to calculate, how I'm going to measure the length of Ryle's tube? Okay, from the, okay, you start from the tip of the nose. After that, you go up to ear. After that, you go up to 𝗵𝗔. Fine now. So how much is the length? Okay, how much is the length coming? So that much length you have to insert inside. Fine. So answer is what? Answer is B. Okay. Fine. Easy to understand. Nose to ear to 𝗵𝗔. Next. Nose to ear to 𝗵𝗔. Easy to understand. Okay. Fine. So what can be the second question? Second question can be this. They can ask you this question: what is the appropriate position of placing this catheter in a patient? What is the appropriate position of placing this tube in a patient? Means in which position? So either your patient should be in sitting position, standing position, or supine position, and neck should be flexed or it should be extended. So this is the question, because you know what? See, when you are going to insert it, whenever you are going to insert it, at that time esophageal opening should be proper, because if there will be improper position of this tube, you can insert this tube into the trachea, you can go into the respiratory tract, right? Now you can go into the lungs. After that, if you wanted to push some saline or any drugs that, okay, like instead of the stomach, you injected into the lungs, and after that patient will be collapsed. So there can be a big disaster only because of this simple clinical practice. A simple procedure is there. Fine now. So second question is that what is the appropriate position? So please understand that patient should be in sitting position and neck should be partially flexed. Okay, neck should be partially flexed. In this position, esophageal opening will be more appropriate. Fine now? So neck should be partially flexed. Answer is C only here. Answer is C only. Fine now. But okay, second question they can ask you, suppose if a patient who is in ICU, if a patient is in coma, okay, if a patient is in coma, but at that time you have to fix a Ryle's tube, you have to insert the nasogastric tube. So what should be the position? Of course, if a patient who is in coma, who is in ICU, and he cannot get up, okay, fine. So patient will be in supine position, but neck should be flexed. Okay, neck should be flexed. Fine, easy to understand. So like according to the situation, you have to mark your answer. Okay, fine. Okay, see one more question they can ask. See, while insertion of this tube, are you using any lubricant? Yes, you are using a lubricant. So what is the function of that lubricant and which type of lubricant you are using while inserting the Ryle's tube? This can be your question. See, any kind of question they can ask. See, this was also the question in AIM. Suppose if a drop of blood, okay, fallen on the ground, after that, which fluid should be used to clean the blood? So this kind of basic questions can come. Easy to understand. So in this question, Ryle's tube insertion, do you use any lubricant? Which lubricant? And what is the function of that lubricant? That lubricant, okay, basically what we use in clinical practice, okay, that is, okay, like xylocaine. How much percent? Up to 2%. So they can ask you what is the function of this xylocaine. See, I hope you know that xylocaine is also local anesthesia. While inserting this tube, at that time patient will be in discomfort position, right? No, so this will be very disturbing for the patient also. Fine. No, so when you are so like at that time you have to apply this xylocaine, this lubricant, Okay, no, so and after that you are inserting it so that suppose if there will be any physical hurt or minor injury, that will be compensated, and after that patient will not be having that much pain. Fine, no? So easy for the patient also. So this is okay, so this is the function of this lubricant. Okay, xylocaine up to 2%. So these are the basic clinical practice questions what they are asking. Easy to understand? Fine. See here, nose to ear to 𝗲𝗏. Okay, in this way we measure the length of nasogastric tube. Okay, fine. Next question I'm asking you. Okay, now you tell me this one. See, now you tell me a boy presents with pain in a wrist. On physical examination, he has severe tenderness at snuff box. Clinician is trying to evaluate the injury over which bone? Basically, this is an orthopedics question. An orthopedic question is this, right? Okay. But this orthopedic question is related to clinical anatomy also. Clinical anatomy and not just anatomy. I'm saying it is clinical anatomy. He is palpating over snuff box. I hope you know the snuff box, right? At the radial part, there is a triangular depression here. Okay, no? So this depression is used to snuff, you know, like used to sniff some drug. Okay, that's why it is called as a snuff box. But there is a triangle, right? There is a triangle. I hope you know that. Okay, like in this depression, there will be two carpal bones which can be palpated. Okay, two carpal bones are there at the base of a snuff box. So what is happening? See, this clinical question we can understand with my clinical experience. I had a patient, okay, 14-year-old boy. I had a patient, 14-year-old boy. Okay, he came to my clinic. He asked me, sir, I'm having a dull pain in my wrist. Okay, I asked him, is there any history of physical injury? Somebody hit you? Any accident? Did you fight with anyone? He told me, no, sir, I don't know, sir. I don't remember, sir. I don't have any fresh injury, nothing like that. I palpated over, you know, like across around the wrist. Okay, like this. Okay, no? I just wanted to check the tenderness. Fine, no, but he was saying, no, sir, I don't feel, but sometimes, sir, I feel pain. Sometimes I feel pain, sir, in my wrist when I do like this. Okay, when I do like this. I asked him, okay, fine, do one thing. Actually, I do not see any swelling here. I do not see severe pain, but okay, get one X-ray done. When he brought his X-ray, I saw one point there over the scaphoid bone. On X-ray, there was blackish spot. There was black spot over the scaphoid. After that, what I did, I palpated, I pressed in his snuff box. After that, he screamed, something like this. I asked him, okay, when did you get this injury? He says, no, sir, 1 year back, sir, I was playing cricket at that time when I was hitting with the bat. At that time, with the tip of the bat, I got hit here. So this was the case of what? This was the case of scaphoid necrosis, right? Scaphoid necrosis. I hope you remember. I hope you can reconnect with your basic orthopedics information, anatomy information, and this kind of clinical practice. So basically what I did there, as per the X-ray, I felt, okay, some problem is there in the snuff box. There was a black spot. I found the diagnosis. Okay, this looks like the case of scaphoid necrosis. And when I did palpation, when I pressed in the triangular depression here in this area, this is called a snuff box. After that, he screamed. So you know what, in this area, in this depression, because I can palpate, I can feel scaphoid and one more bone. Please tell me which bone is there. One more bone along with the scaphoid. Please understand that scaphoid and the trapezium. Okay, they lie at the floor of the snuff box. Very good. ठीक है, तो समझ में आया ये केस. See, See here, what examiner is doing? He's trying to palpate. He's trying to palpate over a snuff box. He is suspecting that there can be some injury over his scaphoid bone. Out of these four options, what is the answer? Answer is D only. D only. Right? Easy to understand? Fine. Okay, next question for you. See, okay, now you tell me. Very good, very good. Okay, now see this question and now you tell me. Okay, before taking the blood sample for ABG analysis, an intern is performing a test. This test is specifically performed to check the patency of which artery? I hope when you see this picture, you can have a picture like in your mind of a test, which is called as, okay, first of all, I want to ask you people, do you remember which test I'm showing you here? And this test is performed before ABG analysis test, okay, before arterial blood gas analysis test. What is the name of this test? Please tell me. Allen's test, right? Allen's test. Allen's test. And I can see that most of you are wrong. See, all of you who are marking this answer, most of you are wrong. Dr. Farman Chaudhary, you are okay, you are correct. Chalo, theek hai. है ना, देखो ये बहुत ही basic question. This is actually a very, very basic question, but most of you are doing wrong. I just want to know. Okay, no, see, because you know, like, see, yeah, this is just an orientation class. If you are doing mistake here, no problem at all. If you are doing mistake here, it means in examination room, you will be correct only. So this is Allen's test. Whenever we have to perform arterial blood gas analysis, whenever we have to perform arterial blood gas analysis test, so what we are doing there for ABG, we collect sample from radial artery, femoral artery, usually, but you know what? See, before doing any test, before performing any test, if you are going to puncture a radial artery and you did not know that patient ulnar artery is already not working, okay, that is already blocked, ulnar artery. See, on the radial aspect, there will be radial artery. On the medial aspect here, this side, there will be ulnar artery. Easy to understand? Fine. So what is happening here? First of all, you want to check that, because whenever you are going to puncture, okay, whenever you are going to puncture an artery, you have to be very clear. You have to be very, very careful that, okay, like suppose if you are going to puncture it and after that, if there will be any blood clotting, radial artery can be blocked, okay, because radial artery and the ulnar artery, these are the major arteries which are supplying this hand portion, right? This hand. Okay, no. So even ulnar artery is not working for some time. Okay, like even ulnar artery is not working, radial artery is going to take care of this part. Easy to understand? Fine. So I have to take care of the patient. I have to check whether ulnar artery is working properly or not. So for that I'm going to perform one test. That test is called as Allen's test. Okay, no. So all of you are going to learn this test wherever you are. Okay, you do this test with me. Okay, so now we are going to check whether ulnar artery is normal or not. Ulnar artery is patent or not. So basically, I am checking patency of ulnar artery so that even if I puncture radial artery, no problem, ulnar artery will take care of the hand for some time. All right, easy to understand? Chalo, theek hai. Okay, see, as per my instruction, you please follow it. See, if I ask you that, okay, you are going to block your radial artery with your, okay, with your, see, first of all, you clench your fist. All of you, first of all, you clench your fist like this. Okay, no? And after that, with the help of your index finger and middle finger, you are going to block. You are going to block your radial artery. You are going to press, you are going to compress your radial artery. Okay, with the help of index finger and middle finger. After that, with the help of your thumb, you are going to block ulnar artery. Now wait for, okay, now wait at least for 1 minute. Okay. I hope all of you are doing like this, okay, because we are learning a test, we are learning a clinical test, okay. This is going to help you a lot during your internship or during your clinical practice, okay, no? So after 1 minute, when you ask your patient to open it, I'm asking you people, now you can open your hand, okay. Now when you are opening your hand, okay, do you see that your hand is yellow? Your hand is white. Why? Okay, because blood supply is stopped. Now I'm asking you to remove the pressure from ulnar artery. Remove your thumb. When you have removed the pressure from ulnar artery, now you tell me, did your hand become red? If your hand is red, it means ulnar artery is normal. Ulnar artery is patent. Now you can take a risk. Okay, fine. Ulnar artery of my patient is working normally. So now I can puncture radial artery. Answer is B only. B. Okay, no, so basically with the help of Allen's test, we check patency of ulnar artery. Repeatedly asked question. This question can be asked in anesthesia, anatomy, clinical anatomy. Easy to understand? Fine. All right, chalo, theek hai. Okay, fine. This is going to be, okay, now I hope last question for today. A 32-year-old lady presents to our clinic with complaints of neck pain. After physical examination and cervical X-ray, clinician prescribed a muscle, okay, like a muscle relaxant to take BD for 3 days. I can take one example of a muscle relaxant, like in clinical practice, what we write, a tablet 𝗬𝗲𝗹𝗻𝗀. Okay. I'm asking my patient to take it twice. Okay. Along with that, I prescribe antacid also, Rantac also. Okay. So you know what? So this is actually a muscle relaxant. You know, for a skeletal muscle, actually we give muscle relaxant. For a smooth muscle, we give, okay, like dicyclomine and all. Okay, Okay, so that will be different muscle relaxant. Okay, smooth muscle relaxants. Fine. So 𝗬𝗲𝗋 I have given for, okay, for the skeletal muscle relaxant. I suspected, you see, after X-ray, I suspected that, okay, fine, there was the overgrowth of the bone, and after that there is compression of nerve, fine, because of that patient is having pain. So I'm just going to give a muscle relaxant, and after that this will be relaxed, so that patient will be having less pain or no pain. Fine. But she comes on the fourth day. And she's saying that she's getting a tingling sensation in her upper limbs. She's getting, okay, the tingling sensation in her upper limbs. Now clinician added methylcobalamin. Now I have added methylcobalamin, OD, along with muscle relaxant. What is the function of methylcobalamin? See, this looks like a big clinical question. But basically what I'm asking you, what examiner is asking you, what is the function of methylcobalamin? So I can say this is the basic question of biochemistry. Okay, where you are learning about vitamins and minerals in biochemistry. Easy to understand. Methylcobalamin is which? Okay, methylcobalamin is which vitamin? Okay, this is vitamin B12. Cyanocobalamin, right? No, cyanocobalamin. Fine. So now you answer me, what is the function of methylcobalamin? See, this question, okay, this is the basic question of biochemistry, but this is framed in a clinically integrated manner. And this is actually a general practice of orthopedics. Fine. When you work in OPD orthopedic, okay, like this case, you know, like every day, at least 15 to 20 cases, you will be having like, okay, back pain. Okay, so back pain, okay, lower back pain, neck pain, shoulder pain. Okay, this kind of pain in orthopedics department, at least every day, like every day, minimum 15 to 20 cases. Fine. So in this question, I'm asking you, what is the function of methylcobalamin? Vitamin B12. Easy to understand. See, please understand that vitamin B12 helps in myelination of nerves. So that there should be smooth function of nerve. Fine. See, in this question, actually, answer of the methylcobalamin is what? Myelination of nerve. Okay, no? So when there will be smooth function of nerve, and when you are adding methylcobalamin, after that patient will not be having the tingling sensation and all. Okay, no? Easy to understand. Easy to understand? I hope this is clear to all of you. Fine. Okay, see here in this same question. See in this same question, like suppose if there will be this kind of clinical scenario, and if my patient is having, okay, if my patient is having, see if my patient is having megaloblastic anemia, finally I got to know, see related to vitamin B12, I am asking you one more question, clinically oriented question. Okay, no? So suppose I have a patient who is diagnosed with megaloblastic anemia, who is diagnosed with megaloblastic anemia. Megaloblastic anemia. See, megaloblastic anemia will be, okay, this will be due to deficiency, okay, due to deficiency of folate also, and methylcobalamin also. Fine, no? Fine, no? See, whenever you see in this kind of question, even, you know, like they can ask you what is the next blood investigation you are going to do. Okay, fine, you are going to do CBC, you are going to do complete blood count and all. After that, when you are coming to know, after further investigation, when you come to know that patient is having megaloblastic anemia. So megaloblastic anemia can be, okay, this can happen due to the deficiency of folate as well as vitamin B12. Fine. How you are going to understand that this is because of, this is due to deficiency of cyanocobalamin or folate? How you are going to differentiate it? Okay, simply on the basis of clinical symptoms of the patient. How? Please understand that megaloblastic anemia can occur due to deficiency of folate as well as vitamin B12. But if patient is having neurologic symptoms, if patient is having the tingling sensations and all, so please understand that in vitamin B12 deficiency, there will be neurological symptoms. So at that time, you can understand according to the clinical symptoms that patient is having deficiency of vitamin B12. And because of that, patient is having megaloblastic anemia. So I hope, see, I have discussed almost seven clinical scenarios. And along with that, I have also discussed some other clinical scenarios. I hope you have some basic understanding that what kind of questions they can frame. Okay, no, whatever you have learned in your anatomy, physiology, pathology, biochemistry. Okay, no. So whatever you have learned, what is the application of subjects which you have learned? Okay, so these will become your future questions. So please understand that this was the day one session, and I have given you the basic, you know, like basic orientation related to the clinical, okay, related to the clinical aspect. Okay, so I hope you have some basic clinical orientation now. So please understand that what kind of session I'm going to take for next 4 days. See, this is my 5 days schedule. Day one is over. I will come live on 22nd, and I will be teaching you integrated anatomy. So basically in this point, in this session, what I'm going to teach you, what are the clinical applications of anatomy, how anatomy is going to help you, to solve all clinical questions, right? After that, I will be teaching you the integrated pattern of physiology and biochemistry. And then I will be teaching you the integrated pattern of microbiology and pharmacology. And then at last, I will be teaching you the integrated pattern of pathology. I have selected only non-clinical subjects. I just want to give you orientation that out of these non-clinical subjects, how clinical questions are being framed. You should have basic orientation so that when you start your preparation, at that time, you should be completely oriented. Okay, no, at that time, you should be completely oriented. So, okay, no, fine. Okay, one more important thing is that, see, please understand that in clinical question, what, you know, like I have shown you the sample of, I've shown you the photo of Ryle's tube. See, in this way, repeatedly asked questions. Sometimes they're giving what? Okay, blood sample tube. Okay, blood sample tube, like, okay, red, purple, okay, red, purple, gray, sky blue color and all. Okay, so many times they will giving you the picture of the blood sample tube. Okay, so where, okay, like in which sample, like in which tube you are going to collect the blood sample for sugar test, for complete blood count, for lipid profile. So this is the basic clinical practice question. Fine. So this kind of question they are asking. See, if they can give you the photo, if they can ask you the photo of, okay, like if we can ask you after giving photo of Ralph's tube, see, they can also ask you related to Foley's catheter, Foley's catheter, urine catheter. Fine. See, they can also ask you. See, every time they are asking some question related to surgical instruments, okay, they can give you the photo of a surgical instrument, and after that they will be asking you, okay, what is the use of this surgical instrument? Okay, no. So I would suggest you that whenever you are going to start your preparation, at that time, please take care of all the pictures, because see, like this time, okay, not so many picture based questions were there, but last time approximately 60 questions were there, and before that approximately 55 questions were there, picture based, image based question. Okay, no. So whenever you are preparing, okay, whenever you are doing your preparation, please take care of all the images, all the pictures, and whatever you are learning, okay, even non-clinical subjects, whatever you are learning, you have to, okay, you have to understand that what can be the clinical application of this non-clinical topic. Okay, so in this way, I will be giving you some guidance for next 4 days. Okay, I hope you have learned something today, and that's all for today. See you tomorrow at 9:30. All right. Okay, then good night. See you tomorrow. Stay safe and all the best. Thank you so much.